My name is Prishani. So today I will be presented about two types of mobility rates, which is mortality and morbidity. Mortality and mobility, there are some differences. Let me explain about the first one, which is mortality rates. These rates measure of the number deaths in a specific population over the certain period. Key mortality rate, which is the number of deaths in facts under the 1 year per thousand live births, and the specific age mortality rates, which help identify vulnerable population and health issues. It's about the giving birth under 1 year and death under that 1 year too. Second one is morbidity rates. These rates refers the prevalence of the disease health condition within a population. Common within a population mobility indicators included the indicator raters, which you all know in details, which is the number of new cases of the disease during this specific time. And prevalence rate is the total number cases both in new existing and population given time.
Hi, my name is Subhanya. My student ID is DHC1123201553. Today I'm gonna talk about health indicators that affect on health and well-being. So my first point is mental health indicators. Mental health indicators are essential metrics that help assess the mental well-being of individuals and populations. They provide insights into the prevalence, severity, and impact of mental health disorders, as well as the effectiveness of mental health services. Here are some key mental health indicators. Prevalence of mental health disorders. This indicator measures the proportion of a population diagnosed with specific mental health conditions such as depression, anxiety disorders, bipolar disorder, and schizophrenia. Understanding the prevalence helps identify the burden of mental health issues in a community. Suicide rates. The number of suicides per 100,000 individuals in a population is a critical indicator of mental health. High suicide rates often signal underlying mental health crisis, and tracking these rates can help in developing prevention strategies and interventions. Access to mental health services. This includes indicators such as number of mental health professionals per capita, availability of treatment facilities, and the percentage of individuals with mental health insurance coverage. Access to service is crucial for effective treatment and support for those in need. Treatment rates. This indicator measures the percentage of individuals with diagnosed mental health disorders who receive appropriate treatment. Low treatment rates may indicate stigma, lack of access, or inadequate mental health resources. Quality of life assessments. Mental health can significantly impact an individual's quality of life. Instruments like the World Health Organization Quality of Life scale assess various dimensions of well-being, including psychology, health, social relationships, and environmental factors. Disability is adjusted life years tally for mental disorders. These measures combines years of life lost due to premature death and years lived with disabilities caused by mental health conditions. It provides a comprehensive view of the impact of mental disorder on overall health. Workplace mental health indicators. This includes rates of absenteeism due to mental health issues, employee satisfaction, and work-related stress levels. Monitoring these indicators can help organizations create supportive work environment. My second point is environmental indicators. Environmental indicators are metrics used to assess the state of environment and the impact of human activities on natural systems. These indicators provide valuable information for policy makers, researchers, and the public to understand environmental health and sustainability. Here are some key environmental indicators. Air Quality Index AQI. The AQI measures the concentration of pollutants in the air such as particulate matter, nitrogen dioxide, sulfur dioxide, carbon monoxide, and ozone. A higher AQI indicates poor air quality, which can have adverse effects on human health and the environment. Water quality indicators. These include various metrics such as pH levels, dissolved oxygen, turbidity, and concentrations of contaminants like heavy metals and nutrients. Example, nitrates and phosphates. Monitoring water quality is crucial for ensuring safe drinking water and healthy aquatic ecosystems. Biodiversity Index. This indicator measures the variety of abundance of species in a particular ecosystem. High biodiversity is often associated with healthy ecosystems, while declining biodiversity can indicate environmental degradation. Greenhouse gas emissions. Tracking the level of greenhouse gases such as carbon dioxide and methane is essential for understanding climate change. This indicator helps assess the effectiveness of policies aimed at reducing emissions and mitigating climate impacts. Deforestation rates. This indicator measures the loss of forested areas over time. Deforestation can lead to habitat loss, decreased biodiversity, and increased carbon emissions, making it a critical environmental concern. Soil quality indicators. These quality metrics such as soil pH, organic matter content, and nutrient levels. Healthy soil is vital for agriculture, water filtration, and carbon storage, making soil quality an important environmental indicator. Waste generation and recycling rates. Monitoring the amount of waste produced and the percentage that is recycled helps assess the effectiveness of waste management practices. Reducing waste and increasing recycling are key components of sustainable development. Energy consumption and sources. This indicator tracks the total energy consumed by a region and the sources of that energy, renewable versus non-renewable. A shift towards renewable energy sources is crucial for.
Hello, I'm Roshni Ganapati from batch 31A. My ID number is DHC0823201064. So today I'm going to present about health indicators, health access and utilization. Healthcare access and utilization refer to the ability of individuals to obtain and effectively use healthcare services when needed. This indicator plays a crucial role in determining the overall health of population and the efficiency of a healthcare system. It encompasses multiple factors including availability, affordability, and acceptability of healthcare and services. This refers to how easily people can use medical care and how often they use it. Basically, it's availability, enough hospitals, clinics, doctors, and medicines in all areas, which means like example, got pharmacies, got in one area we got many pharmacies, so we can get the medicines easily, and there's so much clinics now. We can also check out the clinics if we got any emergency. We don't need to go far away to hospitals, or we can just consume the doctors in the clinics. And they also have 24 hours clinics so that we can get enough medication when we need on the time. Affordability. This explains that the government gives us what we need, which means for an emergency we can pay for insurance, and for emergency they will cut our amount of medication money from our insurance money. The healthcare costs, insurance coverage, and financial support for those in need. Next one is accessibility. Accessibility explains that for the example, for the disabled individuals, they are providing the easy way to medicate them. Next is usage, and the last one is quality of care. This explains the patient satisfaction, trust in healthcare, and availability of specialized treatment. When the doctors and the hospital staffs give the perfect medication for the patients, they are satisfied by their treatment and get cured. So basically what this healthcare indicator mainly defined. Imagine you or someone in your family gets sick, so you need to get better. So for that you need to consume a doctor, you need to see a doctor, get medicine, or maybe even go to the hospital. But what if there's no hospital nearby and the costs are too high, or the doctor is too busy to see you, because there's a lots of patients are there. So that's where the healthcare access and the utilizations come in. So basically, if you need healthcare services, there are enough doctors, enough hospitals, enough clinic. If you are having an emergency, you can afford to reach to the clinics and get the medicines for low price. You can afford them actually. Even if you can't afford at the moment, the insurance you pay monthly will help you when you are at your emergency time. So by this, when people can easily access and use good healthcare, and they stay healthier, they prevent serious diseases and live longer lives. That's all from my point. Thank you.
Hello guys, my name is Rashuni Anapramban Mahiran and my ID number is 09232012 and 73. And I'm going to talk about the health indicators effect on the health and well-being. That I'm going to talk about the nutrition and lifestyle indicators and immunization rates. In nutrition and lifestyle indicators, they are like body mass index, prevalence of obesity, smoking rates, and physical activity levels. And the body mass index measure body fat based on height and weights, and they are used to classify individuals as underweight, normal weight, overweight, and obese. And it helps assess the risk of conditions like diabetes, heart disease, and hypertension. In the prevalence of obesity, it's indicates the percentage of the population classified as obese on BMI. And it's a key risk factor for chronic disease such as cardiovascular disease, diabetes, and certain cancers. And in smoking rates, measure the percentage of individuals who smoke tobacco, and it's strongly linked to respiratory disease, heart disease, and cancer. And it's used to evaluate the effectiveness of tobacco control policies. In physical activity levels, it's assessed the proportion of individuals engaging in recommended physical activity. and its sedentary lifestyle are associated with obesity, heart disease, and poor mental health, and its help in promoting active living initiative. In immunization rates, these indicators reflect the effectiveness of vaccination programs and their impact on public health. In immunization rates, it's got vaccination coverage, impact on disease prevention, public health program effectiveness, and trends and monitoring. And vaccination coverage are like measure the percentage of population that has received recommended vaccines, like include childhood immunization example, measles, polio, hepatitis B, and adult vaccines are like influenza and COVID-19. And the impact on disease prevention are like higher immunization rates reduce the spread of vaccine preventable disease, and its help in achieving herd immunity and protecting vulnerable population. In public health program effectiveness, a key indicator of how well immunization campaigns and healthcare system functions. And its low vaccination rates may indicate gaps in healthcare access, misinformation, or vaccine hesitancy. In trends and monitoring, government and health organizations track immunization data to identify gaps and improve strategies, and it's used to predict the prevent potential outbreak. Thank you.
Hi, my name is Divya. My student ID is THC0823201130. Today I'm going to explain about life expectancy and disability. By the way, life expectancy is average number of years a person can live in nobility rates. Highly, life expectancy generally indicate both health condition and health care. It also can indicate of overall health and well-being in population. Second point is disability adjustment life year. It indicates combined years of life lost due to premature and years life without disable by providing a comprehensive view of the burden of disease. That's all from me. Thank you.